Podcast.
Good morning, Singapore, and welcome to the biggest breakfast show on radio. The Big Show and the Big Show TV comes to you every day at 8 a.m. And today, because it's a Tuesday, we have the one, the only Dr. Geraldine Tan from the therapy room. Good morning, Jerry.
Morning. I'm back in the office.
It's nice to see you back in the office.
Yes.
After, what was it, an HRW?
Yes.
A health risk warning.
And so we're all safe and sound now.
How was your time at home? Tell us a little bit about how long did you have to be there?
I was so itching to get out, but I was like, I have to do the right thing. Yeah.
So how many days?
Because it was a voluntary self-isolation, so it was about like 7 days just to be sure. Yeah. But it was not nice.
Right. So do you do the Marie Kondo thing and
I was working lah.
Oh, you were working.
Oh, you didn't declutter?
No.
Sweep the house one time also never.
Vacuum? Did you vacuum? At least?
I cleaned, I cooked. Yes, I did.
She cleaned and cooked, okay?
There you go. She
Yeah.
cleaned, cooked, and worked. Okay. All right. Let's move on. Dr. Jerry, we're moving on to a very, a heavy topic.
Yes.
October is not just Breast Cancer Awareness Month, it's also the month of pregnancy and infant loss awareness.
Yes. So this month is full of the mental health awareness and a lot of different medical conditions also. So just taking the opportunity to ride on this month with all the different awareness.
Right.
Yeah, it was very difficult because I think last Friday we spoke about I think the Asian parent they hosted a platform and we spoke about the pregnancy and infant loss also.
Okay. All right.
So I thought I'll pick it up today.
So are we talking about pregnancy and infant loss? Or I mean, it's like because we're saying it's the month of pregnancy and infant loss, right? So is it a separate thing, or are we talking about like both? As in, do we celebrate people who are pregnant right now? Is this what the month is about?
It's not about. It is about pregnancy. It's about pregnancy, mental health, and mental well-being, and being aware of some of the little things that we can do to help ourselves.
Okay.
Yeah. So, for example, like, stillborn. So there's Project Sidekicks that the Asian parent actually started. It's a CSR project for them where they would encourage mothers to lie on the side, and count the number of kicks. That's why it's called Project Sidekicks.
Oh, cute.
Yeah.
Okay, so it's two different things. It's month of pregnancy, sort of the celebration of pregnancy, the mental health, the changes that go on while you're pregnant. And then the second bit is infant loss awareness.
Yes.
Whether it's through a miscarriage or a stillborn baby, anything, right? Okay.
Thanks for that, Angel, because Shaun and myself are useless in this area.
Yes, you are. Yes.
So
it's okay. We have two ladies here to balance off the two boys, so it's good.
Yes. Okay, we'll talk a little bit more on the Big Show TV with Dr. Geraldine Tan from the therapy room. But right now, here are the chords from Ireland. So I think before we continue, it's very important, I think, to establish, maybe more for the men, what happens when a woman becomes pregnant, as psychologically? Is that a good question? Is that a good question?
It is. It is a good question. Yeah. I don't think many men ask it.
Yep.
Psychologically,
Thank you for asking.
what happens?
I mean, let's check in with Angel. Angel has gone through, right?
Well, I mean, I guess psychologically, obviously, you're elated, you're happy, but then also you have to prepare things like getting your body ready to carry a human being. I mean, it's a massive, massive task.
For 9 months.
For 9 months, yeah. And if you're someone that's been constantly active, constantly watching your weight, constantly concerned about how you look like, as a lot of people are now, especially because of social media and the type of expectations there are out there for people to look a certain way, then it's even harder, But if you're someone who can't really be bothered, then just really you're able to enjoy the joys of being pregnant, And there's so many different stages. There's some people get hit by really bad morning sickness, and then some people get hit by really bad mood swings. And then some people have really easy pregnancies. So it's very hard to mentally prepare, I guess. I would say take one day at a time. That's the kind of best way you can really put it. Jerry, what was your experience like?
I think it depends on whether it's a wanted or unwanted, right?
True.
Or unplanned, not unwanted.
Yeah.
Oh, actually,
some are unwanted as well. Yeah,
unwanted. Yeah. So mine was planned, and mine very very wanted. This pregnancies. So it is filled with a lot of excitement. What's gonna happen. But it's also very stressful in the sense that there's a lot of expectations, and you never know how much expectations or what are the expectations around pregnancy until you're pregnant, and everybody seems to be a guru.
Everyone's got something to say, right?
Yeah, it's like amazing. It's like, oh, you're pregnant, you should do this, you should eat that, you
don't
must
eat
do
this, don't look at that.
Oh
Don't
my
look at that.
God.
Yeah. No, yes. There are all these like old wives' tales, They're like, don't go to the zoo and look at monkeys because your child is gonna look like that. Don't use a pair of scissors on the bed because you're gonna have a miscarriage. There's all sorts of like old wives' tales, A cleft lip
And
is
it's so
because you
scary,
did
right? It
this.
doesn't help someone who's carrying a child, right? When people
the
say that.
stress.
Yeah,
No.
and it's unfounded. It's kind of like, okay, so if your child does end up being born a certain way, then they'll blame it on the fact that you did something during your pregnancy.
Right.
Yeah.
But if it doesn't, then they're like, oh my God, you're so lucky that didn't happen. It's like you can't please
you
everyone.
Cannot win, lah. You cannot win.
You can't win.
I got this, which I thought was really funny. Like, don't eat crab. I'm like, why shouldn't I eat crab?
Crabs? Why?
As in crabs? As in crabs?
Crabs.
Yeah, okay.
Because I think in one of the dialects is if you eat the crab, your child is gonna come out very sharp tongue or something
Oh my
like
gosh.
that.
Isn't that great though?
I don't know.
With
More chili
pincers.
crab for you.
No, I ate. I was a naughty girl.
Was.
So if you're one of those people watching right now, okay, and you being one of those gurus going up to your pregnant friend and saying all these things because you heard it from your mom or whoever, your mom's mom. Shut up!
Yeah, right?
You're not helping.
Let the woman have her baby.
Yeah.
I mean, there are body changes like what Angel you were talking about, right? So you have to really psych yourself up to, oh my gosh, my body looks weird now, and it is weird. You're having a protrusion
Yeah.
right in front of you.
Yeah. Like for my first pregnancy, I put on 28 kilos.
Oh wow!
28 kilos.
I was a whale. It's like
Is that
massive.
normal or?
No, it's not normal.
Oh, okay.
No. I mean, because I had been modeling all my life.
Oh, yeah,
like,
like,
I had been doing that, and then finally, when I got pregnant, I was like, oh my gosh, now I can eat anything I want, and get and put on weight, and no one's gonna say anything because I'm pregnant. But no, it was not the best thing to do.
It was not healthy.
No, it's not healthy.
Putting on 28 kilos.
Yeah.
28 kilos and
28.
losing it after that.
Yeah.
Here I am trying to lose 6 kilos.
There you go. Try
her
and
what
have
she
a baby,
did.
Glenn.
Oh my goodness.
You just need a push.
Yeah.
No, Angel is amazing.
Yeah.
I also put on like close to 20, and then as I hit the near 20 mark, I think at 20, Dr. ran Geraldine, and she said it with all seriousness. Yeah, Geraldine, I think you need to cut down on your bihun. Your fried rice.
That's so much fun, right? Being able to eat whatever you want, and no
But
one
how-
can say anything.
But how do you ladies do it though? So how long did it take for you guys to
Lose all the weight?
Yeah.
It took me, for myself, I think it took me about 2 years
Okay.
to go back to like pre-pregnancy weight.
All right. So about
Yeah.
2 years for you too, Jerry? Around there?
Thereabouts, I think. The post-pregnancy massage actually helped a lot.
But I mean, for women, it's a huge thing. I mean, it's not like your body bounces back after you have a child. I mean, your stomach, like nothing could have prepared me for what my stomach looked like after the child came out, because it's literally like an elastic, if you think of an exercise band that's been, there's an echo, right?
Yeah,
Yeah, but now it's gone. You see? Is that,
I shifted. Okay, I'll do this. I'm gonna.
because we're going
shift
back
it
on
a
air, so
little
we
bit.
settle the
Yeah.
echo thing first, then we go back
Okay.
on air.
Yes.
Okay, testing. Yeah, it's gone
Okay.
now.
fine.
No, it's gone.
Is it okay?
yeah, it's okay.
Yeah, you sound
It's
okay.
okay.
Okay, stand
Okay.
by. We come back on and
yeah,
we can
yeah.
carry on. Huh?
1FM 91.3, Roxette fading like a flower. Describing some of you right now who are watching us. Perhaps maybe you didn't get enough sleep last night. You're in the office, fading like a flower.
Eye bags.
Or at home wanting to go back to bed.
Good morning, Singapore. Welcome to The Big Show and The Big Show TV. Our guest for this morning is the lovely Dr. Geraldine Tan from the Therapy Room. Once again, good morning, Jerry.
Morning.
Good morning. So today we're talking about a month of pregnancy as well as infant loss awareness. And Jerry and I are still on the pregnancy bit and how women can never be prepared for what your body is going to look like, what your body can do post-pregnancy as well. But let's chat a little bit more about the importance of pregnancy mental health, Jerry. I mean,
Yes. Yes.
is there a lot of are there a lot of cases out there of women being pregnant and kind of foregoing their mental wellness?
Yeah. So
Or what happens?
I think antenatal depression is shocking. It in Singapore itself is 1 in 5 women that actually have antenatal. That means depression during pregnancy, and we don't actually realize it. So there's a lot of talk about postnatal depression, but not enough talk about antenatal depression.
So what are the causes for depression during pregnancy?
The husband.
Could
One of the main causes can be, you
Yeah.
know, so a big thing is whether you have support from your husband. And some of these women, it is really, really sad because I see them, and when I talk to them, there's their husbands, have affairs during the pregnancy, and that is very, very sad. So there's a lack of support there, and then that wanted unwanted pregnancy. If it's a wanted pregnancy at that point in time, then what do you do? Do I still continue with the pregnancy? Do I not continue with the pregnancy? So many women struggle and they feel guilty for having such thoughts. So you compound more and more emotions during the pregnancy period. Financial. So sometimes they're worried about financial, as many of us do, right? Can I afford to bring up the child? And they start calculating, and the more they calculate, the more worried they are. Working women may get worried about their job security. I know many women who choose not to tell their employers about their pregnancy and if they're up for promotion until they get that promotion.
Are they obligated to let the employer know that they are pregnant?
Well, if the employer is going to give you 4 months off,
Yeah.
we owe it to the firm to let them know about, to hire someone temporarily, or that, there will be a gap that you would not be able to service the organization.
Yeah. But what do you mean tell the employer? Unless the employer is visually handicapped. I mean, he's going to find out.
so
They're going to
soon,
find out, right? I mean,
Actually, in the early trimester, especially for many women for the first pregnancy, you actually cannot
Can't see.
So the
Really?
Yeah.
first and second trimester, some women are so blessed.
Yes. Yeah. Like some you can't tell until they're 6 or 7 months, because at the end they really start to blow up, right? in the most polite sense of the term. But early on, it's very easy for a woman to hide it.
Yes.
It's very easy for a woman to hide it.
Baggy
Yeah.
clothes.
Okay.
Yeah, baggy
Yeah,
clothes
yeah.
and yeah.
Some of them don't even need baggy clothes. It's just amazing, and they look like they still look like models.
Yeah.
Yeah, but hiding is never really a good idea. Lah.
Yeah.
No, I
Right.
mean, if you need to hide your pregnancy, then obviously something is wrong, because it should be something. It should be a proud moment for any woman, whether they're married or single
Yeah.
or anything.
Yeah.
It's a huge deal.
So 2 points here before we go and play a song.
Yeah.
Okay, before we play you a song. Number one, husbands, be more supportive of your wives if they're pregnant. Okay.
Even when they're
need
not
your
pregnant.
support. Yeah, even
Okay, I
when
digress.
they're not pregnant, it's okay. No, I'm kidding. Be more supportive of your pregnant wife. And two, I mean, don't hide your pregnancy.
Yeah.
Be proud of it.
People will give up the seats now on MRTs. You don't have to hide.
And there are lots of women in the world who would give up anything to be in your shoes as well.
All right, we're speaking to Dr. Geraldine Tan this morning about pregnancy and infant loss. We'll continue to talk to her on The Big Show TV. In the meantime, here's Coldplay with Up and Up on 1FM 91.3.
And we're back.
Yeah. And I think it's really important for the mummy to be happy so that the baby can be happy, even in vitro. I mean, okay, not to put more pressure on mothers, but there are a lot of research that shows that, if the mother is unhappy during the pregnancy, the correlation of like impulsivity, behavioral issues, attention issues, would increase for the child. So I mean, as all mothers do, we want to give the best start for our children. Yeah.
And it's perfectly understandable. I mean, you're cocooning this human life in your body for 9 months. It's so understandable that anything you feel, eat, or say, or listen to, external noises and stuff like that, will be heard and felt by the child as well.
Yes. So, yeah. So we want to ensure the pregnant mummy is a happy pregnant mummy.
Yeah. I think children are always closer to their moms. I mean, in general, I mean, the majority, I think. I mean, close in terms of connected.
Julian will agree with you.
In terms of connection, right?
I think it also depends on many factors. Some children are closer to their fathers, and it depends on the home situation as well.
But I feel like it's a different closeness. Like we can all be like buddies with our dads, but there is a different connection with our moms.
Well, that's why whenever you watch movies and stuff like that, who's the first person that people call out to, right? They're always looking for their mommy, whether when they're scared, they're always like, "Mommy!"
Yeah.
That's always the first. They're not like, "Daddy."
Yeah, exactly.
And daddy will beat you also. Scared for what?
I think moms are the emotional connection. So they help us connect to our emotions. That tends to play the role of a more logical person and the fixer for situations and crisis. Yeah. So moms are more human, I think. I don't know, for lack of a better word. Yeah, more human in the sense that we permit the emotions to flow.
Yeah.
Not apathy.
Yeah. Not taking anything away from the dads or the fathers. But I'm just saying, because I mean I feel that way with my mom as well,
So we've spoken about pregnancy, things like antenatal, postnatal depression, and mental health. What increases stress in pregnancy? Well, besides like what you said, like monetarily, no support.
Some of them have very poor attachment to their mothers. So they have very conflictual relationship with their own mothers, or, it's a very insecure sort of attachment. So there's this hot and cold. So you don't know how to feel about your own baby.
So it's like mommy issues?
Mommy issues. Some of them, are young, so they don't know what to do. Very, very lost. First-time mothers can also be quite stressed. Doesn't mean that if you have a few more, you won't feel stressed.
You'll be more stressed.
I suppose the worries will increase if you had a bad pregnancy before. Or a bad experience. You had a miscarriage, you had stillbirth, you have an emergency cesarean, you had a complicated pregnancy, preeclampsia. So all these would increase the level of anxiety within the mother. So all these are stressors. Yeah.
Okay, so let's we spent a bit of time talking about the pregnancy. What about the infant loss? Like when you say infant, that's I would imagine 1 and below, or 18 months and below.
Well, I suppose stillbirth will be slightly different.
Oh, if it's stillborn, yeah. Okay.
Yes. So the age of a baby being recognized as a baby, stillborn, has now been changed to 22 weeks.
Oh, wow. Okay.
WHO. So mothers get to experience the full suite of all the pregnancy, whatever benefits there are.
Okay, just for the guys' benefit, it's a full pregnancy is 40 weeks.
40 weeks.
So 22 weeks is when
Halfway.
it's just over halfway. What was it before?
25 or 25 or 28 weeks. Yeah.
Right. Okay.
Yeah.
Okay. 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 So I mean, grieving parents. I mean, I know people who also grieve when the baby is or the pregnancy is as soon as 8 weeks. As soon as they find out, and then they miscarry and they do grieve. What do you say to someone who has just lost a child? I mean, is there any right thing to say, or is saying nothing at all better than?
I think a simple "How are you?" would suffice, and the last thing you want to say to them is, "Oh, it's very
what happened?
common." What happened? It's so better than, "Oh, it's very common."
That's very common. Yeah.
Yeah. So whilst first trimester miscarriages do occur, I think for the parent themselves that is not easy, especially if they are feeling all the effects already, and
they've been trying for a long time.
They've been trying for a long time, so telling them, "Oh, it's very common. I know so and so that has it, or has gone through that.
And they're fine."
And it sounds so dismissive.
Yeah.
That it's just not helpful for them at all. Yeah.
And you can't compare as well.
Yes, you cannot compare one pregnancy to another pregnancy, and I have to add this. It is. Many people don't realize it, but actually the ART is very triggering for some of the mothers who are crying.
Oh.
Because
it looks like a pregnancy kit.
It looks like a pregnancy test kit. So it's not the insertion, it's the waiting and looking at the lines.
Have you encountered anyone that said that?
No.
For you to say that?
No. Again, because everyone is doing that, right? It suddenly becomes normal and something that we just have to do. But if you think about it, right, that pregnancy. So I was first alerted because I think I said it before. I lost my first one, it was a first trimester miscarriage also. Very difficult. Even until today, the waves come that you still remember the little one. And I was feeling uncomfortable with that test kit, and I wasn't sure why. But no one was talking about it, and who would actually make that connection, right? Because everyone is doing it. Until I realized, I was like, no, but whilst waiting for the next pregnancy and the next pregnancy, this test kit, it looks exactly like the pregnancy test.
It does. And you're also waiting for a line to appear, and how many lines to appear. And
you're waiting for 2 lines. This one, you're waiting for only one line.
Okay,
hold on, Jerry. Angel, traffic, yeah. Good morning, Singapore. Welcome to The Big Show and The Big Show TV. Our guest for this morning is from the therapy room. Dr. Geraldine Tan joins us. And the topic for today is pregnancy and infant loss. Good morning.
Yeah, so we've been speaking a little bit, quite a lot about pregnancy, importance of mental health and postnatal and antenatal depression. But now we've moved on to infant loss awareness. And Jerry, on the Big Show TV, you were talking about what to say and what not to say to grieving parents. So can you give us a couple of tips how we should behave and what we should what's the best thing to say and not say?
Okay, so let's go with what not to say. Let's not say, you're young, you can try again.
Yikes.
Oh my goodness.
Yeah.
So rude, insensitive.
Well, you'd be surprised. There are a lot of people that say that, oh, both of you are very young, you can try again, without
Realizing.
with the best of intentions, but without realizing that you are dismissing how the couple is feeling, right? Or how the mother is feeling. Or, even in normal pregnancies, you hear this really, very common during gatherings. Oh, this time a boy, next time you try for a girl, okay?
Yeah.
I'm not sure that we can choose gender.
So what is it that makes people speak like that? I mean, is it just pure ignorance or is it just not thinking before speaking? What is it?
I don't think that they realize it has such
It's
a
rude.
impact. Yeah. And they don't realize that it's rude. They don't see it as rude because everybody says that, So if you hear the grandmas and old uncles and aunties, they tend to say things like that, Maybe they in the past it was very, very common. But now that we're more aware, it doesn't make sense anymore. Yeah. So we speak with more mindfulness.
Yeah,
So
I
what-
think it's okay to excuse like the older generation, but
They're not going to change.
yeah. But for the younger ones, right? I feel like if you don't have anything good to say,
Don't say anything,
just don't say anything.
So if you find out someone's pregnant, congratulations. If you find out someone's lost a child, I'm so sorry to hear that. That's like a full stop, right?
Or if you can't even say that, then don't say anything.
Don't say anything at
Just
all.
say I'm
No.
sorry. I'm sorry.
Yeah. So if a parent does want to share about the loss, the last thing they want is to have an awkward silence. Yeah. So you can always ask, would you like to talk about it? Yeah.
Okay.
How
yeah,
are
that's
you?
a good one.
Yeah.
But if you don't want to talk about it, then just do what Angel did. I'm sorry for your loss, and move on to another topic that is a little bit more neutral. They will appreciate it. Yeah. Or if you can't manage it, don't go that direction. Don't talk about people's baby.
What about for couples that one feels a greater loss than the other? Because I feel like it depends couple to couple how long they've been trying, how involved the father is or the would-be father. Is it a case of the men don't get as affected as the women?
Actually, all of us grieve differently. So it doesn't mean that the father doesn't show it. He doesn't feel anything. But most of the time, what the men would say is, I just want my wife to be happy. And the first role the couple has is husband and wife, not mother and father. So to the husband, you're still my wife. So that's their main role. The wife is the main role for the husband. So when they come, most of the time, the woman is grieving over the loss of the child. But the husbands, if it's an early miscarriage, the husbands are more concerned about the wives.
The wife's well-being.
Well-being, correct. And they say, you know what, if she's okay, I'm okay. But baby is gone. So they're very pragmatic. They're very practical in their outlook in life.
Man, it's so tough, man. So very, very tough.
It is tough, and it tugs the heartstrings every time I have to speak with a couple, every time I have to talk about, losing a child.
Yeah.
And it's really not easy. Yeah, and it doesn't mean, so the other thing is, it doesn't mean that after, 1 week, it's all okay. It doesn't mean that. For years, once a parent, always a parent.
It never goes away.
It never goes away, and the parent will grieve, no matter how many years passed. Yeah, so even for mine, it's almost 14 years.
And you
It's
still think about it.
Yeah. So it's not easy, no matter at what stage you've lost a child. It stays with you. So I always tell the parents that let no one determine how long you grieve, because you're always the child's parent.
So I suppose another thing not to say to someone who's lost a child would be, oh, it happened so long ago.
Yep.
Right. It's time to move on, right?
Yeah. Oh, you would be
surprised.
surprised.
Yeah.
Yeah, you would be surprised. Oh, it happened so long ago. Why are you still thinking about it?
Well, this obviously comes from someone who's never experienced it.
It sometimes is that way, or sometimes is the other person's discomfort about talking about it. Yeah.
Okay.
Or sometimes it's that person is being affected by how this other person is feeling. So it's almost like, come on, get over it already.
Doesn't know what to say. Yeah,
exactly.
Yeah.
Which is horrible, really horrible. Okay, let's play a song once again, and we continue to talk to Jerry, and we welcome Julian, co-editor of SG Karmat, to the show, to the Big Show TV as well. Here's Ed Sheeran with Castle on the Hill on 1FM 91.3. People who have not grieved before, don't understand what people who are grieving are going through. And so after a prolonged period of time, they just feel like, hey, why don't we just get over it?
Yeah.
And that's the worst thing ever, right?
Yeah, that's the worst thing to say.
Tougher for pregnancy loss, because many of the parents, talk about leaving the hospital without a baby.
Oh. And you have so many plans.
Yes.
You have so many plans that you've made. It's not, and you've not even been able to welcome this little human into the world to even to even live through some of those plans.
Yeah.
Must be tough.
It's very tough, and they go back home. What do they do with the
room
or the little clothes that they have to wear?
It's very heartbreaking, I must say. I think it's especially after everything, and you go back home and it's quiet and I think what Angel said. I think it really hits a point. I mean, you've already made plans. So what are you gonna do now? I think it's you kind of feel lost.
Yeah, and it's not the kind of plan making where you have a contingency plan. You don't say to yourself, okay, here's a contingency plan. If I don't have the child, this is what I'm going to do. Nobody does that.
Yeah.
It's always the positive, right?
Yeah. And the worst thing is also confinement without the child.
That would be for later, like a pregnancy that's gone on for a much longer time, right? Do they also go through confinement when it's an early miscarriage?
We would encourage so that your body can recover, right? And but it is also very painful for the mother to go through that confinement, without a baby. So it's heartbreaking to hear that. I don't know how else to say. It's just this really painful feeling in my heart when I hear each mother say that. So if you're a friend and you're there with them, just be with them. I think that's the best thing. If you don't need to talk about the loss, you really don't need, because sometimes they're not ready to talk about it. If you can be with them, you can, if they want to pack up certain things, give them an extra hand to pack together with them.
Moms and dads watching, I mean, look, it's time to come to terms with your feelings. I mean, if you really feel you need professional help, then I think you should get professional help.
Yes.
That's
A lot
why
of
people
help.
like yourself, Jerry, are so important.
Yep.
Okay.
So
It's not good just keeping everything, bottled up, It's not good for your overall health.
But
Anyway.
people will talk only when they're ready to talk, right?
Yeah.
yes.
Speaking of which, we also want to thank everybody on our Facebook chat. So a lot of people are sharing their stories about how they've gone through
Oh,
a lot of
wow.
things. So Dr. J, after this, maybe you can
You can
go
have a look
through-
at our.
Yeah, so a
I
lot of
will.
stories and everybody.
I
So we're
will.
sending love to everybody out there.
We are
Aw.
sending love to everyone. We're sending love to everyone and embracing each and everyone. All of you are important, and the baby is important, and the baby is yours. The
And
baby
thank you for
is-
sharing as well.
Yeah.
It's
Yeah.
not easy.
We should have read a few of those earlier
Yeah, I
on.
didn't realize that there were any on
Quite
the.
drama
Yeah,
one.
maybe
I'll cry.
later you can have a look at the question, at the stories, like what
Stories.
Shaun mentioned, and maybe
Yeah.
you can highlight a few. We can bring it up next week as well, Jerry.
Sure.
Yeah.
Okay.
Sure.
Yeah.
Okay.
And I'm gonna let Julian have his time, so I'll end it with a little quote from Ralph Waldo Emerson. For each thorn, there's a rosebud. For each twilight, a dawn. For each trial, the strength to carry on. For each storm cloud, a rainbow. For each shadow, the sun. And for each parting, sweet memories when sorrow is done.
Oh my goodness, you almost made me cry there. Okay.
Thank you, Jerry. Thank you
was
so
lovely.
much.
Thanks for having me.
Have a wonderful
Bye,
day
everyone.
ahead.
I'll
See
see
you.
all of you next week.
Next
Yeah.
week.
See
Thanks,
you,
Dr.
Jerry.
Jerry.
See you.